Welcome to the Explainer. All right, today we're going to talk about something that's pretty common and honestly can be kind of scary: getting a rash after you start a new medication. We're going to break down exactly how you can tell when it's just a minor thing and when you really need to get help fast. So, let's start with a number that might actually surprise you: 45%. Almost half of all adverse drug reactions decide to show up on our skin. That makes skin issues the single most common side effect of any medicine out there. And because it's so common, it leads to this classic dilemma, right? You start a new antibiotic, maybe a new blood pressure pill, and then boom, a few days later, a rash pops up. So, is it nothing to worry about, or is this the very beginning of something dangerous? It turns out just knowing a few key signs can make all the difference. To get to that answer, we need to understand what doctors think is the single most important idea here. And that is the difference between a simple reaction and a complex one. Getting this right is absolutely the key to knowing when it's time to worry. So what's the dividing line? Well, a simple reaction is just that. It's simple. You've got a rash, maybe it's itchy, but it's all happening on the skin. A complex reaction, though, that's a whole different story. That's when your whole body gets in on the act. And the number one sign? It's a fever. If you see swelling or blisters or sores in your mouth or eyes, those are huge red flags too. So, this is the crucial point. If you take away literally one thing from this entire explainer, please let it be this golden rule. A rash by itself is one thing, but a rash plus a fever after you start a new drug, that changes the game completely. It's your body's way of screaming that something more serious is going on and you need to get medical help right away. Okay, so with that golden rule in mind, let's dig a little deeper. Most of these drug rashes actually fall into one of four main patterns, or families, and we can look at each of them through that same simple versus complex lens to see how doctors sort them out. And here are those four families. First up is exanthematous, which is a fancy word for a measles-like rash. It's by far the most common. Then you've got urticarial, which we all just know as hives. And finally, you have the less common but often much more serious blistering and pustular types. Let's start with the big one, the exanthematous eruption. And when I say big, I mean it. This is the classic drug rash, making up something like 95% of all cases. It just looks like a bunch of flat and slightly raised pink spots that can all start to merge together. Your doctor might call it a morbiiform rash, which literally just means measles-like. And look at this. Here is our simple versus complex rule in action again. A simple rash usually shows up about a week after starting a drug. But its dangerous cousin, a condition called duress syndrome, shows up way later. We're talking 2 to 6 weeks. And it brings along a high fever, a swollen face, and it can start to affect your internal organs. You see, the timing and the fever are the absolute dead giveaways. Okay, family number 2 is the urticarial eruption, or, what the rest of us just call hives. These are those classic, super itchy, raised welts that can pop up, disappear, and then reappear somewhere else on your skin. And we see the exact same pattern here. Simple hives, they show up fast, sometimes within minutes of taking a drug. But the complex version, a serum sickness-like reaction, that's a whole different animal. It's delayed, showing up 1 to 3 weeks later, and it comes with friends, like fever, joint pain, and swollen glands. It's a full body inflammation. Now for family number 3, blistering eruptions. These are way less common, but this is where things can get really serious. These are reactions where your skin literally starts to form fluid-filled blisters. So paying attention to the details here is absolutely vital. This comparison right here might be the most critical one we look at. On one hand, you have a simple blistering reaction called a fixed drug eruption. It's very specific. It's one spot, or maybe a few, that shows up in the exact same place every time you take that drug. But on the other hand, you have Stevens-Johnson syndrome and toxic epidermal necrolysis, and these are, no exaggeration, medical emergencies. They cause widespread, painful blistering, and your skin starts to peel, almost like a terrible burn. Tragically, the mortality rate can be as high as 34%. So with all these different rashes and different timings, you have to wonder, how do doctors actually figure out which drug is the culprit, especially when a patient might be taking several medications at once? It's kind of like being a detective. The first and maybe the most powerful clue they have is the timeline. As we've already seen, different reactions have totally different incubation periods. Hives are super fast, showing up in minutes. A simple rash takes about a week to appear. But those really severe, complex reactions like SJS or DRESS, they have a much longer fuse, often taking anywhere from 2 to 6 weeks to finally show up. So beyond just the timeline, clinicians have a really clear process. First, they take a super detailed drug history, looking at every single new thing you've started in the last 3 months. Then they have to rule out other causes, because a viral infection can look a whole lot like a drug rash. And finally, they weigh all the evidence to figure out which drug is the most likely bad guy based on the rash pattern and the timing. Okay, so once a drug rash is identified, what happens then? Let's take a look at how simple rashes are managed and then peek into what the future of preventing them altogether looks like. Now, for a simple reaction, and I'm stressing simple, no fever, there's a lot you can do at home to get some relief. The goal is really just to calm down the itching and irritation. So think cool compresses, lukewarm baths with a little bit of baking soda, and really gentle, unscented moisturizers. But, and this is a huge but, the single most important step for any reaction, simple or complex, is to identify and stop the drug that's causing the problem. This quote from the medical literature says it all. Stopping the offending drug is paramount. It's the most important thing. And that is why you have to talk to a healthcare professional so they can make the right call on which medication needs to be stopped. You know, all of this has been about reacting to a problem that's already happened. But what if we could move past that? What if we could actually prevent these reactions from ever happening in the first place? Well, that's exactly where a really exciting field of research is headed. This is where it gets so cool. Scientists have found these incredibly strong links between specific genetic markers in our DNA, they're called HLA alleles, and a person's risk of having a severe reaction to certain drugs. For a few key medications, like the HIV drug abacavir, the official guidelines now recommend genetic testing before a patient even takes their first pill. And that leaves us with a really powerful final thought, doesn't it? We are moving into an era of personalized medicine, where a simple blood test could one day tell us which drugs are perfectly safe for you and which ones could trigger a life-threatening reaction. The ultimate goal here isn't just to make these severe reactions treatable, but to make them completely and totally preventable.